Hi. So this entire live is dedicated towards acne, acne scars, and all the questions and issues that you want to talk about. Acne is what we are going to talk about. I have Dr. Anchal joining in from Surat. Dr. Anchal is a friend of mine, MD from the prestigious AIMS. So Anchal, we're so happy to have you. And until Anchal joins me in, I'm going to answer a few questions that are coming up. There's Anchal. Hi.
Hi.
Can you hear me?
Hi, ma'am. How are you? Yes,
so
yes.
Good to have you.
It's breaking, but
so my voice is breaking.
So good to do this with you, ma'am.
I love to. Now is better.
There's a little bit of an echo, ma'am. Like, can't hear you clearly.
You can't hear me clearly? One second. Hello, hello. Is
now
that better? It's better now? Okay, super. So this is Anchal for all of you who joined in late. She is an MD dermatologist from the prestigious AIMS Delhi. And one of those juniors that caught my attention because she was so good at her work. So Anchal and I are going to discuss today everything about acne, all that you wanted to know. So Anchal, how is
short about Dr. Rashmi Shetty? She has been a mentor and she is a very renowned celebrity dermatologist with clinics in Mumbai and Hyderabad, and she is involved in training dermatologists from all over the world, not just India, and I've always looked up to her. So this is such a pleasure to do this with you, ma'am.
How sweet. Thank you. So Anchal, let me throw the question at you first. So what are the 3 tips that you give your patients when they come to you with acne? What is your 3 favorite tips that you tell them to do? And what are the 3 things that you tell them not to do?
Okay, so first I would always ask them to be regular with whatever treatment I'm giving and to have patience. Whenever you're treating acne, have a lot of patience. It's not something that can go away overnight, and you stick to the regime. You'll be able to notice results in about 3 to 4 months. Okay, so that's what I tell them, to always have patience, stick to what I tell them to do, and also don't overwash your face is one of the things, because acne patients tend to really go overboard with using a face wash and really drying their skin out. So that, and just trust the process. Trust the process, be regular with treatment, and you will definitely see results. That is what I ask them to do mostly. And not to do, ma'am, I ask them to avoid sugar and dairy as much as possible. And also change the pillow cover at least every 2 days, and shampoo their scalp every 2 to 3 days, because sometimes a lot of patients do come with acne who have dandruff and also a lot of oily scalp that tends to, especially in humid area like Surat, that oil tends to trickle down on the sides of the face and they get really bad acne on the sides of the face. So keeping your scalp clean is very, very important.
So true. So 2 things that she brought up that I want to stress is about overwashing the face. So mostly acne prone skin is generally oily. A lot of dry skin can also have acne, but generally it's oily skin. So one thinks that, oh, because my skin is oily, I can keep washing my face, or I need to keep washing my face. There are a lot of patients who also come and tell me that, doc, I'm not using soap, but each time I feel oily, I keep splashing water and washing my face. And which is how many times? 10 times. I'm like, oh my God, absolutely not. Even simply putting water and allowing the face to just dry without wiping it will take away the moisture from the face itself. And if you keep driving your face to over drying it, body works with a feedback mechanism. So the oil glands will think, oh my God, I'm so dry, let me go out and overdrive and produce more oil. So that's what's going to happen. 2, again, the significance of her expressing to you that you shouldn't be washing the face so many times also holds good, because mostly when you're doing anti-acne treatment, for example, ingredients like benzoyl peroxide, salicylic acid, adapalene, all of this is used. Most of them can be irritants. Over and above that, if you keep washing your face with specialized ingredients in your face wash, it's going to make your skin sensitive, dry. So just not a thing to do. So that was a great thing that she said, where you need to watch. The second thing that I really picked up, and I thought that was a good tip and I want to elaborate, is about the pillowcase. A lot of time, even after treatment, for example, you end up doing a microneedling radiofrequency via scar. and then you end up going home and sleep on a dirty pillow. It's like face which has so many multiple wounds and you end up putting it in a dirty pillow. For example, you have a dandruff. If you have an acne-prone patient with a seborrheic skin, you end up having dandruff. You have slept the previous night. The dandruff obviously falls there on it with a nice layer sitting and growing. The next evening, you again go and put your face onto that. So not done. So yes, these are, I think, something really important that she brought about. Now I want to focus about asking her which are her favorite anti-acne creams. Anchal, which is your favorite anti-acne creams? If you have to give creams to people, what are the 3 things that you send home your acne patients?
Benzoyl peroxide, azelaic acid, and adapalene. I start with adapalene. If, while the patient is able to tolerate after a few months, then I switch on to tretinoin. But I always start with adapalene.
Yeah. Yeah. I think that's so beautiful. That's something that's world over followed now, adapalene and benzoyl peroxide. Unlike earlier where antibiotic was given as a cream, a lot of you people have heard of Clindamycin, right? So that's something I've seen a lot of people say, oh, I've been using Clindamycin for how long? For over 2-3 months. I'm like, what? No. By now, I think our patients are educated to understand steroid is something bad for the skin. The next education that you must understand is a prolonged, unmonitored use of antibiotic creams are equally dangerous. So therefore, the acne treatment is totally switched now to rather controlling oil, rather doing bacteriostatic, which means just stopping the bacteria from growing, to a little immunomodulatory things. So it's important for us to think in those lines, and please don't go over the counter and just buy Clindamycin, Clindac A, and then start using anything that
niacinamide,
T-back. There's so many of this. There's one more.
Resistance, and that is just going to make your acne even tougher to treat. So just sitting at home and applying antibiotic ointments and creams is actually doing more harm than good. So please don't use any of these over-the-counter medicines.
Yeah, it is so important. So what I like to also add in terms of cream is moisturizer. A lot of times I've been asked saying, oh, but I have an oily skin, acne prone skin, should I put a moisturizer? You of course need a moisturizer. Probably you need a water-based one. Probably you need a very light, milk-like, flowing moisturizer, something to hydrate you and keep that base oils of your skin intact. So that is what causes a good barrier. So therefore, you can end up kind of healing the skin along with what the doctor is giving. Anchal, what I'm going to do is just take a few questions. How long can we use Glycosix? As long as your doctor has told you to. Glycosix does 2 things. It exfoliates, it hydrates, it lightens your acne scar. So you can use it for the long term, not a problem.
For spots, dark spots works for that as well. Even good for back acne. Glycolic acid, salicylic acid works really good for back acne as well. So
yeah, oh yeah, that's a nice thing. A lot of people will have black back acne, so that really works a lot. One second, why am I not able to see the questions? Anchal, can you see the questions?
Yes, ma'am. How to get rid of whiteheads and blackheads. Okay, so blackheads and whiteheads are also like a precursor of acne. It is a type of an acne lesion. So sometimes your acne can start as a whitehead. So you have to follow a proper regime of a proper cleanser that controls your oil, as well as an exfoliant, either a benzoyl peroxide or adapalene that can be used or a salicylic acid can help in reducing your whitehead. So please don't take it lightly, even if it's just black and whitehead. Don't sit at home and pop it. It's just going to make it worse. Push it down, give rise to a bigger acne. So get it treated. Blackheads and whiteheads have to be treated properly.
That's a very good point. Did you hear what Dr. Anchal said? Don't try and push it down. It leads to a bigger acne. So if you guys think the gland of the acne is like this, it is not. It's like a bunch of grapes. So you try pushing it down from one opening, you're infecting all the other lobules. So it just becomes like a mess. And have you experienced, you'll keep telling me that, doc, on the same place I keep getting repeated acne. That's because at some point you've sat and pushed it and prodded it and made it into one thing. So the next question here, Anchal, that I thought was interesting is, how long can we use azelaic acid? Again, safe product as long as you can. You could even use it during pregnancy. The other question is...
in patients who have dark spots after acne, or even acne excoria, which leaves behind dark spots, works really well on acne as well as on the dark spots. So works well. And also acne works well.
Yeah. So when she said acne excoria, it only means when you have an acne and you keep picking at it, That's just a technical term she used, okay? So that makes it black, and you get a brown pigment, black pigment, gray pigment, depending on your skin color. And for that, acetic acid works brilliantly well, and it's safe to use for the long term. The next question there is, can we use isotretinoin? Is it safe? You want to take it first?
Yes, ma'am. It's a gold standard medication, but please only under prescription, only with a prescription. Understand how to use it, how long to use it, what dosage. Stick to the dosage. Don't feel that, okay, it's getting better with 10 milligram. Let me just up it to 15, 20. No, you have to stick to what your dermatologist tells you. Isotretinoin is a life-changing medicine. Definitely works wonders in acne, but only to be taken under strict supervision of a dermatologist. Follow the proper regime, how to use it. Also, we then tweak the topical medications. When I prescribe isotretinoin, I will not give a benzoyl peroxide just right in front, because that can lead to more agitation. Even a retinoid, I would not just start off at, until the patient is used to it. And we always give a moisturizer, a lighter face wash versus a person who is not using isotretinoin. So there are a lot of changes that occur when a prescription contains isotretinoin. Please understand it properly and take it only with a prescription of a dermatologist. That's all I'll have to say.
Very true. Just to add a little more there, I have again a lot of patients who come and say, oh, we've learned to self-medicate. So they end up, each time they get a bout of acne, they'll just do some 5 days of antibiotic orally, 10 days of isotretinoin. Does not work like that. Please don't think it's that easy. If it was that easy, we would have all, as doctors, done an online course of 3 days, isn't it? And then become doctors. It is not like that. So there is so much that goes into firstly putting the right combination, for what time, the other things that we sit and think about it. Like she rightly said, if she would put someone on an isotretinoin, we anticipate in the next 10 days the skin would dry. So we would end up taking care of what needs to or needs not to do. We would anticipate the skin could get sun sensitive. She will also end up taking care of that. So there are so many other factors that she is taking care of, along with putting the medicine, which you are not going to get in a Google search. Yeah?
Correct. Absolutely.
So the next interesting question is clindamycin an antibiotic? Yes, it is. How do you deal with bumpy skin? Depends on what the bumpy skin is. Because
bumps can be either whiteheads, it can even be milia, it can be syringoma, it can be a lot of things. So just saying bumpy or red bumps, there are multiple causes for bumps on the skin. So we need to really see it to be able to comment.
Again, to dumb down what she's saying, it means either the obstruction of a sweat gland, obstruction of an oil gland. It could be a growth on the skin. It could be a growth under the skin. It could be anything. It could simply be a scar tissue under the skin. It could be an occluded gland which has become cystic. So it's very difficult to tell what is bump in the skin. The other question is, derma roller effective? Very. I love it. What about you?
Yes, ma'am. It's a good treatment. Now I moved to microneedling RF, which is also like the same principle, but with heat. But yes,
yeah,
always works.
Dark circle, we'll take it another day. Today, let's concentrate on acne. Okay, moisturizer. And which moisturizer is your favorite?
For acne. Sorry, ma'am.
Which moisturizer is your favorite for acne-prone skin? Someone has asked you. Tell me yours.
Elle and Oriza, Acrophy. These are the 3 brands that I really prescribe the most.
What I like is Clinique has a moisture surge, fantastic for acne-prone skin. Then the other thing that I may like is probably simple thing called Moise MF. I quite like that. That's the simplest in the range. Then there's something called as Emoline. Again, very available across the counter and very economically priced. Again, very good for acne-prone skin. Cetaphil range of moisturizers are also good for acne-prone skin. Suggest best cleanser for acne. Anchal, go for it.
So depends on what other medicines you're on. Okay, if only for acne, I would want to include a salicylic acid or a glycolic acid based face wash. But if you are using isotretinoin or something that's already drying and irritating, then I want to go for a more gentle face wash. But a Cetaphil oil control face wash is my go-to favorite. And if you're on isotretinoin, I prefer something very light like an Episoft face wash, or even Cleanance. Avene has a good face wash that works really well for acne-prone skin.
So I think I pretty much agree to what she's saying. So I'll take the next question. Should we use LED mask on our skincare? You can. Don't expect it to change your life, but you can.
Just get it for relaxation along with maybe a little bit of it, but
Yeah.
it's not going to give you, the
Yeah.
best skin. It's
In
simple.
real life. Exactly. So open pores can be taken at risk. So open pores to me is simply the bigger, wider opening of your oil gland. It can happen in two situations by and large. One, when you're younger and you have a really oily skin, you have an open pore. Then when you're older, when your collagen is kind of going down and your skin relaxes or becomes a little loose, is when the pore openings can get wide open. Or some people simply have genetically a skin which has wide pores, which is very difficult to then treat.
Yes.
So what are your three favorite things that you do for open pores?
First, retinoid cream to apply, and also derma roller, derma pen work really well. And I like to do in clinic microneedling RF, and even carbon peel. Depends, ma'am. If it's just like oily skin that is giving the prominence of the open pores, then carbon peel, a few sessions of Q switch gives really good results. And even microneedling RF is one of my favorite for open pores.
Super. So all three of them I also love very much. But about the carbon peel, I want to tell everyone, because suddenly it became a rage on the Instagram because everybody started showing carbon peel. It looked beautiful, black skin clearing off when you do the laser on top. So it just became a rage. But please understand, carbon peel can also dry your skin.
Yes.
So simply do a carbon peel as a fancy thing on a dry, mature skin. Not at all. It is more like she specifically said for an oily skin, maybe an acne prone skin, maybe an open pore skin. That is what carbon peel suits best for. Just because it's a rage, just don't go and do it. The other two things, in addition, what works well if you want an instant magic is micro Botox. Yes, Botox. The scary Botox is something that works brilliantly on open pores. But please go to an expert, because when we do that, we're injecting micro diluted Botox all over the region where there is also muscles which pull your smile up. So if your doctor does not inject appropriate dosage, strength, depth, area of spread, you may have issues with your facial movement. So please, this one, go to an expert. Which toner do you love?
I don't prefer toners at all, ma'am. What is your take on toner? If you have very oily, you can go for a toner to kind of balance it out. Otherwise, normal to dry skin, sensitive skin, avoid toners.
There you go, Anchal. Now you know why I love you. Totally same thought. So toner is always something that I never thought was an important step in your skincare regime at all. I knew at some time that CTM was the in thing to do. Everybody's like CTM, CTM. So toner is firstly also a misnomer. What is a toner? What are you expecting? Skin tightening, oil reduction? What are you expecting out of a toner? So toner is a step you can always skip, but there are some nice toners if you have a very oily skin. You want to just wipe it off with a thin layer of acid, which kind of keeps the skin then dry for a long while. You could do it. In between, there are some wonderful international companies which came with hydrating toners, which had lovely hydrating substances. Most of them have now changed into mists. So you have a lot of mist which is hydrating. So that's something that you can.
I'm okay with rose water, green tea, non-alcohol based toners are okay. Alcohol based toners obviously absolute no. And if you have very oily skin, toners sometimes contain this Pixie Glow tonic, which contains glycolic acid in a very low concentration. Might work well if you have very oily skin, but it's a very skippable step if you have dry or sensitive.
Perfect. Skincare for teenagers. So teenagers, again, depends if you have an oily skin or if you have a dry skin. What's your lifestyle? I am not one for 10-step regime at all. So I know most teenagers, Google search, you all look at various influencers. Everybody's influenced by everybody else these days. And then there is so many skincare, anything which looks pretty on the rack, you all pick up. So to me, the tip for teenagers is skincare is not like fashion. I know everybody will tell you what is the skincare regime. We are not going to tell you that today. I'm just wanting to make this content a little different and special, where I'm going to give you some gyan which says it's not fashion. It is not makeup so that you look at the prettiest color and you pick it up. No. This is something which is very expert driven. 1, 2, any small skincare. You may think, it's just a face wash, it's just a serum, but can actually change your skin in the long term for the good and for the bad. So choose your skincare wisely. Please invest on going to a dermatologist. In every city, there are so many dermatologists now. Please go to a dermatologist, get your skin examined, see what your lifestyle is, and then get yourself a plan. So that is the tip from me for skincare for teenagers. Anchal, what do you think?
I would add on to that, just keep it minimal. Keep it minimal. No need to, nowadays everybody wants to use acylic acid, niacinamide, anything that they hear, BHA, some serums,
Yeah, yeah.
pee, wash off in 10 minutes. No, don't fall into a bandwagon. Like ma'am said, it's not a trend. It's not a fashion trend. It's skin. It's going to be there with you for life. You want to treat it well. You want to understand it, do the best that it deserves. So please keep it minimal. No need to layer products over products. If you just know your skin type, and if you go to the perfect, the proper dermatologist who understands your skin, then just 2 or 3 products are going to be enough. No need to layer. Minimal.
Very, very true. So what's the other question there? Post care after controlling acne. Good question. Take it.
Ma'am, I like to give a moisturizer for sure for long term, and also I like to maintain on a retinoid, either a adapalene or a tretinoid, depending upon how they're able to tolerate. That I feel will really help in keeping the oils down, stopping the dead skin layer pile up on the skin, and also reduce the number of comedones that is forming and new acne. So retinoid is my go-to for maintenance. Once we are off with the oral medicines, then a face wash that contains either salicylic acid, glycolic acid, along with a moisturizer, a gel-based sunscreen, and a retinoid. A tretinoid cream is what I prefer to maintain. What would you do, ma'am?
Likewise, I think the scalp and the skin hygiene that has to continue thereafter forever as a lifestyle. Your food habits that we have counseled and changed during the acne treatment again continues for a lifetime. It just doesn't shift after the acne is gone. And then probably creams like whatever Anchal said can keep your oil under control, and make sure you use a good exfoliator to make sure the plugging of your pores does not happen. So to me, that's good enough. And I like giving supplements. I love to give. I think anything, even an acne or anything on the skin, starts off with an oxidative damage and then an inflammation. So to keep those two down is super important, and to keep your barrier intact and healthy, which will help your skin heal yourself. So of course, I like to give supplements from my range. So we end up giving the Ra Defense and the Ra Bright for antioxidant and an anti-inflammatory, and anhydrate, which keeps the dermal layer intact. So that's something that I really love doing. What's your go-to supplement? What do you like?
For acne, ma'am, I only give zinc and astaxanthin if I feel that that patient requires an extra antioxidant boost. Otherwise, other than this, not too big on supplements.
Super. So that sounds really good. And I'm going to quickly take some quick fire questions. When to use to reduce acne marks. What to use? Sorry. So acne marks are usually 2 types: the texture and the color. Texture, no matter what you use, you need in clinic treatments. The color, maybe you could use azelaic, kojic, acids onto your glycolic. The next is how to put an end to hormonal acne. Quickly, you will answer.
Sorry, ma'am.
How to put an end to hormonal acne.
End to hormonal acne. Okay, so hormonal acne is complex. It's not just a cream or a tablet that you pop. It's a lifestyle change. We need to get your menstrual cycle sorted. Try to understand what hormonal imbalance is happening. Are you overweight? Are you taking a proper diet? Is there exercise in a daily routine? That will sort out first, and then we'll put you on some hormone tablets along with maybe isotretinoin, depending upon how severe acne is, what type of acne you have, along with topical medication. So put an end. Tough to say, because it's a long-term treatment. I tell patients for hormonal acne, give me at least 6 months and up to a year of treatment for you to see sustained results. So along with in-clinic medications and some procedures, making some lifestyle changes in diet, exercise, eating healthy, all that is very, very important to treat hormonal acne.
Super. So the next question is sunscreen for kids. I like Cetaphil, and I like something called Isdin, which does not irritate the eye. The next question is how to treat acne marks. We answered. Your opinion on LED mask for acne, please, you take it.
Not a fan of of LED masks as such. I feel like, it's an adjuvant. Like if you want to just relax at the end of a day, and you want something to kind of beat the stress, then maybe you can add it, but don't expect just the LED mask to get rid of your acne or treat your open pores or your dark spots. No, you need more customized, proper pointed treatment to kind of address those issues. So LED mask is just like a rejuvenation, a little bit of a relaxation. That's all it's going to do.
So on an ending, I enjoyed this, and I'm sure all the audience got a lot of gyan. As a finale question or a comment, I'd like Anchal, please tell me where exactly is your practice? So people who are listening, a lot of them do online consultations with me, and then they ask me for doctors in certain cities. So this whole idea of doing the series of live is just that, to tell you these are people that I really trust and love from different cities that can, you can continue. So just tell me where exactly is your practice?
Okay, I practice in Surat, ma'am. Surat, the area called Parley Point. So I've been practicing in Surat since the last 6 years now. So before that, I was in Delhi. So yeah, I'm in Surat, Gujarat. So yeah, you can visit if you have some dermatological problems. I'll help in sorting it out.
Yeah, I'm just really good at it. So, and then, of course, I'm in Bombay and Hyderabad. You can see me anytime. Please keep the questions pouring for both of us. We'll continue answering as much as we can on the DMs. And I shall keep you informed about my next live, which is going to be Saturday at 5 p.m. again. So keep sending me your wish list, questions, topics, and we can try and accommodate all that. Anchal, it was an absolute breeze and a pleasure talking to you. Love you.
I love this. Thank you so much for having me.
Bye.
Bye.